Well, welcome everyone. I think we'll get started. Thank you so much for joining us this afternoon. My name is Jillian McConnell, and I'm a knowledge broker with Brain Exchange. And on behalf of my colleagues from the Kidney Foundation of Canada, Sarah Cruikshank and Lydia Lauder, we welcome you and are so pleased to have you take part in this event. Before we begin, I do want to take a few moments just to review the technology that we'll be using. The audio is provided over the phone, which means if you're hearing my voice, then you're all set. And the visuals or the slides are provided by the online link that you should have received in the connection details. And that way you can watch the slides as our presenter speaks. On the bottom left of your screen, you'll see a blue bubble. And if you move your cursor or your mouse over to it, you'll see Chat with the Presenter. Click on that, and the chat pod should appear. And that's how you can communicate with me during the event as well as with presenters. Please be aware that only the presenters and I can see your notes in the chat pod, not your fellow participants. And this is also where you can send your questions during the Q&A portion. I also want to make you aware that all of your lines have been muted for this call for the time being, and that just helps us minimize any background noise or private conversation, sirens, dog barking, that sort of thing. If you do need to ask a question or if you have a concern during the actual presentation, then please use the chat pod, as I, of course, won't be able to hear you. The presentation is being recorded, and within a week or so it will be available on the Kidney Foundation of Canada website. And you'll also receive notice that the recording is available via email. So for the purpose of today, those are really the only features you need to be familiar with. The webinar is scheduled to be 90 minutes in length. Our presenters will speak for about 60 minutes or so total, and then we'll have the remaining 30 minutes at the end for Q&A and discussion. I do ask that people refrain from asking questions in the chat pod until the end of the presentation, unless, of course, the question is with respect to a definition or an acronym, anything that will impact your understanding of the content as we move through the webinar, then fire away and I'll do my best to answer. Okay, so now that the technical aspects have been taken care of, it's my pleasure to now introduce our webinar topic and the presenters for today's webinar. One note before I do that, though, I do want to make a special acknowledgement, and that is that this webinar is proudly supported by an unrestricted grant from AstraZeneca. So we thank them for their support. So today we're going to be talking about diabetes and kidney disease. And before we move forward with the introductions, I do want to let you know that we've had a slight change in the presenters for today's event. Unfortunately, due to some unforeseen circumstances, Cheryl Harding was not able to present at today's webinar event. However, I'm really pleased to report that Lydia Lauder has graciously stepped in, and we are now able to proceed with three wonderful speakers as planned. So Lydia Lauder is the National Director of Programs and Public Policy at the Kidney Foundation of Canada. She graduated from the University of Sydney in New South Wales, Australia in 1994 with a Bachelor of Nursing. She has remained in nephrology throughout her career and has over 20 years' experience in clinical practice and programs with a special interest in home dialysis and CKD management. She has worked for the CKD health charities in Australia and Canada, and in her spare time, she loves spending time with her family and traveling. Melissa Atcheson is a registered dietitian and certified diabetes educator with over 18 years of experience as a renal dietitian at Grand River Hospital in Kitchener, Ontario. Melissa specializes in pre-dialysis and peritoneal dialysis nutrition care, a keen interest in optimizing the nutritional status of her patients. She is active in both provincial and national initiatives and is the National Secretary for the Canadian Association of Nephrology Dietitians. Melissa is a content expert for the Kidney Foundation's Kidney Community Kitchen website and is an active participant in the Ask a Dietitian feature. Outside of work, Melissa's favorite thing to do is spend time with her two beautiful daughters. And last but certainly not least, we have Rosemary Lejeune. And Rosemary was diagnosed with type 1 diabetes at the age of 25. As a registered nurse, she knew very well what that meant. And after 18 years, she was told that her kidneys were failing, and 7 years after that started peritoneal dialysis. She was put on a list for a kidney and pancreas transplant. She was on the list for 3 years when she was diagnosed with cancer and taken off the list. After 4 more years of dialysis, she received a kidney and 5 years later a pancreas. She is a wife and mother of 2 and grandmother of 6. She's active in women's ministries in her church and a founder and facilitator of the Kidney Connect support group in Kitchener, Ontario, as well as a peer support volunteer. So on behalf of our participants, we welcome Lydia, Melissa, and Rosemary. And Lydia, I believe we're starting with you, so the floor is yours. And just as a reminder, Lydia, *7 to unmute your line.
Thank you very much, Gillian. I really do appreciate that warm welcome, and welcome to everybody here on the webinar. So I thought I would just get started talking in general a little bit about diabetes and kidney disease. And what I wanted to get started is going back to 101 and talking about why the kidneys are so important. Kidneys are as important to your health as your heart or your lungs. The kidneys do three essential things. They regulate water. So for your body to work properly, it must contain just the right amount of water. One of the important jobs of the kidneys is to remove excess water from the body or to keep water when the body needs some more. The kidneys also remove waste products and help to balance the body's minerals. So many of the substances in the blood or other body fluids must be kept at the correct level for your body to function properly. For example, salt and potassium are minerals that come from food. The body needs these minerals for good health, but they must be kept at certain levels. When the kidneys are working properly, extra minerals such as sodium and potassium leave your body in the urine. The kidneys also help to adjust the levels of other minerals such as calcium or phosphates, which are important for bone strength, growth, and other functions. Okay. So what is kidney disease? Chronic kidney disease is the presence of kidney damage or a decreased level of kidney function for a period of 3 months or more. There are two tests that are used to detect kidney damage and assess how well your kidneys are functioning at removing toxins and waste products from your blood. So blood tests are used to measure something known as serum creatinine levels, which helps indicate how well the kidneys are filtering the blood. Creatinine is a waste product made from muscle use and the breakdown of the protein you eat. As the blood creatinine rises, kidney function decreases. Decreased kidney function means that your kidneys are not able to remove the toxins and waste products from your blood as well as somebody with normal kidney function. The estimate, or also known as a percentage of kidney function, is called the glomerular filtration rate, or GFR. Sometimes the GFR is also referred to as the estimated glomerular filtration rate, or eGFR. The glomeruli are tiny blood vessels in the kidney that help filter waste. The GFR is a way of measuring how well the kidneys are working by determining the rate at which the glomeruli are filtering waste products from your blood. The eGFR is the most common way to measure kidney function at kidney clinics. Another simple lab test that is often used is known as urinalysis, or a urine dipstick. This looks for blood and protein called albumin in the urine, and it's also useful in detecting kidney damage at an early stage and determining your risk of losing more kidney function. The filters of the kidney do not normally allow protein in the urine, so if protein or albumin is detected, it is a sign that the filters of the kidneys are being damaged. The more albumin that you have in your urine, the greater the risk of losing kidney function over time. Other blood tests, x-rays, kidney ultrasound or kidney biopsies can be needed to diagnose a certain type of kidney disease and to determine the appropriate treatment for it. Okay. So just understanding chronic kidney disease. Kidney disease can range from mild to severe and in some cases lead to kidney failure. Kidney failure is sometimes known as end-stage kidney disease. Kidney disease often starts slowly and develops without symptoms for over a number of years, so CKD may not be detected until it has progressed to the point where your kidney function is quite low. So in other words, you can have CKD and not even know it. Fortunately, most people do not progress to end-stage kidney disease, especially if they are diagnosed early and are able to take steps to preserve their remaining kidney function. There are a number of risk factors of CKD, some things that you can control, like smoking, and others that you can't, such as aging. People with diabetes, high blood pressure, or who have a family history of kidney disease are at an increased risk of developing CKD. Children who were born with kidneys that did not develop properly are also at risk. Additionally, people of Aboriginal, Asian, South Asian, Pacific Island, African, Caribbean, and Hispanic descent are at higher risk for CKD. And now moving on to the topic of today. diabetes and chronic kidney disease. There are many different kidney diseases and disorders, as we just mentioned. Some kidney diseases are present at birth and others develop as we grow older. Often, kidney disease is associated with other medical conditions like diabetes and high blood pressure. Most of these diseases attack the filtering units in the kidney, which damages their ability to remove waste and excess fluids. There is no cure, but it might be possible to prevent CKD or slow it down. This is especially true in people with diabetes or with people with high blood pressure or both, which are the leading causes of kidney failure. So diabetes is a disease that is caused by a lack of insulin in the body's or the body's inability to properly use normal amounts of insulin. Insulin is a hormone that is a very important chemical messenger that regulates the level of sugar or glucose in the blood. The body must have insulin to function. So people with diabetes may take medications that can either make the pancreas produce more insulin or help the body properly use the insulin that is being produced. Or they may take insulin by injection or pump. Even with the use of insulin or other medications, people who have had diabetes for some time often suffer from damage to the small blood vessels, such as the ones in the filters of the kidney. Most people's kidney function changes slowly, and not everyone with chronic kidney disease will develop end-stage kidney disease. But you need to know that damaged kidneys won't heal. In most cases, supporting your kidney health and protecting your remaining kidney function depend on maintaining a healthy lifestyle and managing other medical conditions you might have. One of the most important ways to preserve your kidney function is to gain control over other medical conditions you might have. The first step is to follow the advice of your healthcare team and take your medications as prescribed. It's very important to control your blood sugar if you have diabetes. And the reason for this is that high blood sugar clogs all the blood vessels, including the filters of the kidney. This causes decreased kidney function. High blood sugars can also damage the nerves that tell you when your bladder is full. A full bladder can cause the urine to back up into the kidneys and cause further damage to those precious kidney filters. This can lead to increased bladder infections as well. Keeping your blood sugars well controlled will help you to protect those delicate filters in the kidney and may slow down the decline in your kidney function. Some tips for managing your kidney disease if you have diabetes is to talk to your doctor or nurse about what your target blood sugar level should be and how often and when you need to check it. Test your blood sugar as often as directed by your healthcare provider. The A1C blood test tells you what your average blood sugar level was over the past 2 to 3 months. Have this test done every 3 months or as often as your doctor suggests to see if you have control over your blood sugar. Maintain a healthy lifestyle and weight. Try to aim for 150 minutes of activity every week. So that's about 30 minutes 5 times a week. Assess what you're eating and improve your food choices. See a dietitian if you need help with this. Don't smoke. Control your cholesterol through proper food choices, and if you're on medication, make sure you take it as directed by your doctor. It's also important to manage your blood pressure. People with kidney disease who also have diabetes should aim for a blood pressure of about 130 over 80. Also, infections in people with diabetes tend to progress rapidly. If left untreated, many infections, especially urinary tract infections, can further damage the kidneys. People with diabetes must take special care to have infections treated immediately. And make sure to have your kidney function tested every year or as often as your doctor suggests by having blood and urine tests. So there are different types of medications that are commonly prescribed for chronic kidney disease. Some medications slow down the progression of the disease or manage the complications of kidney disease. Others might reduce the risk of heart disease or stroke. It's very important that you take your medications as prescribed. Kidneys play an important role in removing medications from your body. As your kidney function changes, the medications you need may also change. Sometimes the dose will be decreased, or you'll need to take some medications less often, or even stop taking some medicines altogether. Your healthcare team will use your blood test results as a guide to make sure you're getting the right medications at the right dose. It's important to learn as much as you can about all your medications. Okay. So some tips that might help you manage your medications is using a medication aid to help you take your medications at the right time. There are several different medication aids available to help you manage your medications. It's really great to talk to your pharmacist about what might best work for you. Bring your medication bottles and packages to your doctor's appointments. This is really important on your first visit. Bring all your prescription medications, over-the-counter products, vitamins, herbal remedies, or natural supplements that you are taking. Keep a current list of all your medications. If you need help, ask a family member or pharmacist to make a list based on the directions of your medications and your doctor's instructions. And bring this list with you to all your medical and dental appointments. It's important that you take your medication list with you to the emergency room if you need to go. Make sure any changes to the list are updated, as this will keep your healthcare team in the know. Also, let your pharmacist know that you have chronic kidney disease or diabetes. Your pharmacist can work with your doctors to make sure that you are taking the right dose of medication for your level of kidney function. So what you should know about your medications is the name of your medications, the strength of the medications, how much to take, how often and what time of day to take them, what the medication is used for, what are the common side effects to watch out for, what to do if you miss a dose, whether any tests are needed to monitor how the medication is working. And to learn what's best for you, ask your doctor or pharmacist about your medications so you'll know how to get the most benefit from them and how to manage any possible side effects. So kidney disease affects you physically, but it can also affect you emotionally, socially, and spiritually. When you're first diagnosed, you may not want to tell others about your disease. You may feel angry, guilty, sad, or lonely. These feelings are normal. It helps to talk about it, build your support network, and connect with others who have experienced living with kidney disease. Stay physically active and involved. Identify your favourite activities and ways to incorporate them in your day. And importantly, you are the most important member of your healthcare team. The more you know about kidney disease, the more you will feel in control and confident in making decisions about your health. If your kidneys do fail, there are 3 main treatment options available: dialysis, a kidney transplant, and non-dialysis supportive care. Dialysis is the most common treatment for failing kidneys. There are 2 types of dialysis: peritoneal dialysis and hemodialysis. Peritoneal dialysis uses the lining of your abdominal wall to clean the blood, allowing treatment to take place in the comfort of your own home. Hemodialysis pumps your blood through a dialysis machine to remove waste and excess fluid. This can be done at home or a dialysis centre. A kidney transplant involves surgery to place a healthy kidney from a donor into your body. The new kidney takes over the work of your failed kidneys so that you can live a more normal life. A transplant is considered a treatment and not a cure, so you will need to take medication for the rest of your life. If you have diabetes, you're also at increased risk of low blood sugars before you transition onto diabetes, which is the pre-dialysis stage, and once you start dialysis. The doctor who takes care of your diabetes may need to decrease your insulin on a regular basis, or if you are taking another medication. You should report repeated low blood sugar reactions to your doctor. It's important to maintain your blood sugar in the range recommended by your doctor and your diabetes team. This is because this can help decrease thirst and control your fluid intake. And while we're talking about thirst, I'm also going to now take the pleasure of moving on in this presentation to Melissa Atcheson. Thank you.
Thank you, Lydia. Thanks for everyone for joining us this afternoon, and I'm going to spend the next 20 minutes or so talking about balancing the diabetes and kidney diet. At diagnosis of diabetes and throughout the journey of diabetes, diet is really the first way and the main intervention to help lower blood sugar. And as Lydia was talking about, it's really important to achieve good blood sugar control to help reduce the risk for complications like chronic kidney disease. Diet can help to control those blood sugars, which helps slow chronic kidney disease, and there's other aspects of the diet as well. A low-salt diet can help control blood pressure, which helps slow the progression, and we often look to avoiding certain additives in the diet, which can help protect your kidneys, and making sure not to have too much protein, which helps as well. It's important to remember that with chronic kidney disease, it's not necessarily the same diet recommended for everyone. It really depends on what stage you're at. And Lydia talked about, having between mild to severe chronic kidney disease. And the diet recommended to you might depend on which stage you're at. And those diet recommendations can change as your kidney function changes. And that can sometimes be confusing. So I'm hoping to take some of that confusion out of the picture today. It's important to remember what, when, and how much you eat helps to keep your blood sugars stable, and that can really help to keep your kidneys healthy. When we look at the diabetes diet, the main component is looking at carbohydrates, all those foods that turn to sugar, like starches, starchy vegetables, fruits, and dairy, and looking at the timing and the portions of those foods and trying to balance the amount of sugar from the food you eat with either the amount of insulin you make or the amount of insulin you might inject. And that's all to get a target blood sugar. And like I said, getting those target blood sugars, and that's, as Lydia mentioned, looking at your A1C, your average blood sugar over the last 3 months, and trying to keep that number around 7 or under, or whatever your doctor might suggest for you. And that can really help to reduce the risks of complications like chronic kidney disease. When we add in the kidney diet, it becomes more than just looking at carbohydrates. As I mentioned before, we start looking at other components of the diet, like how much protein you're eating. And we try to avoid excess amounts of protein, especially excess animal protein, to help protect your kidneys. As I mentioned, a low-salt diet is important to help keep your blood pressure on target, and that helps to prevent damage to the kidneys. In terms of additives, we're trying to avoid phosphate additives because we know that can damage the kidneys. And sometimes we have to look to other minerals like potassium, and that's really to keep your blood levels within that tight range that Lydia alluded to. In terms of fluid, I often get questions about, should I drink less because my kidneys aren't working well? And unless your doctor has directed you to drink less fluid, you should keep drinking plenty of fluid. That's really important for kidney function to stay well hydrated. So I'm going to go through some slides and talk about the basics of kidney and the diabetes diet and what's important for keeping your kidneys as healthy as you can and keeping your blood sugars in control. The first point is to try to eat 3 meals a day. It's really important to include breakfast within an hour or two of getting up. That really helps to kickstart your metabolism and control your hunger later on. It's not a good idea to skip meals when you have diabetes or chronic kidney disease. You want to eat regularly, and that really helps to regulate your blood sugars. If you can't eat big portions, sometimes it's easier to have 4 to 6 smaller meals rather than 3 large meals, and that it can work as well. The most important thing is eating regularly. And you want to make sure to have a balanced diet. And that means including at least 3 of the 4 food groups at each of your meals. So the 4 food groups would be the starches, the vegetables and fruit, dairy, and of course protein. And you want to have at least 3 of those 4 food groups each time you eat. Including a portion from the protein group when you eat can help keep you full longer. It helps slow down the absorption of the sugar from the carbohydrates, and it can help to keep your blood sugar stable. Carbohydrates are the foods that turn to sugar, and they increase your blood sugar level, so it's really important to keep serving sizes in mind for those foods. And this is another way of looking at a balanced meal, looking at your plate and imagining a line down the center where half of your plate is filled with vegetables, a quarter of your plate, or around your fist size, is the grains, the other quarter of your plate being the protein food, and then on the side, milk or milk alternatives and fruit. When we're looking at fruits and vegetables in the kidney diet, sometimes as your kidneys filter less and they're working less well, potassium levels might increase in your blood. And we might have to start looking at certain fruits and vegetables and ask you to try to change them for lower potassium fruits and vegetables, because it's really important to keep your potassium levels normal in your blood for your heart health. So this isn't something to protect your kidneys. Potassium is good to include as long as your kidneys can keep the level in your blood normal. And this tends to happen as you lose more kidney function, that you might have to start looking at this mineral, potassium, and try to exchange the highest potassium foods for lower potassium foods to keep your potassium level normal in your blood. And you would normally hear from your healthcare team if this is important for you to do. If you haven't been asked to change your foods for your potassium level, then you want to keep eating a balanced diet and include all of the fruits and vegetables. I've included a list here of the highest potassium vegetables and fruit that would be important to limit or cut down in if your blood potassium is too high. The first one is potatoes, and that's probably the highest potassium food that we eat. This also includes sweet potatoes and yams. Boiled potatoes are lower in potassium, partly because you remove the skin, and that removes some of the potassium. And then when you boil potatoes, some of the potassium is lost into the water. And so that's lower than having a baked potato or a fried potato. If you need to watch your potassium, you still want to be careful with how much potatoes, and limit yourself to half a cup in a day. Potato chips and French fries would be very high in potassium, as would avocado, bananas, plantains, oranges and orange juice, cantaloupe and honeydew, prunes, prune juice, and concentrated tomato sources like tomato soup, tomato juice, or tomato sauce. There's other things to consider if your potassium is too high as well, and that might be vitamin or mineral supplements. Some of them contain potassium, and if you're trying to limit potassium, you don't want to be taking extra through a pill. Dairy is also important to consider. Milk and yogurt are quite high in potassium, and with the diabetes and kidney diet, we generally recommend half a cup to a maximum of 1 cup a day to help limit potassium, as well as some of the other minerals and protein. Sometimes low salt products use potassium chloride to give a salty taste. So there's actually a salt substitute on the market that contains potassium chloride instead of sodium chloride, and that wouldn't be good if you're trying to avoid potassium. Processed foods can also contain many different potassium additives. These are the names that you might see in the ingredient list that suggest that potassium has been added to a food, and those are things to steer clear of if your potassium level is too high. The next slide I have is about grains, and this has sort of changed since I've been in practice. When I first started as a renal dietitian, it was common to suggest to people to change from their whole grains that were, thought to be very healthy to white bread, but that has changed for a few different reasons in the past couple of years. One of those reasons is that we would suggest restricting whole grains and changing to white bread because we knew they were lower in phosphorus. But we've since learned we don't have the enzyme that releases that phosphorus in grains, so we can't really absorb it. So it's not protective for people to avoid whole grains to control their phosphorus. And whole grains have lots of important benefits to them. They help keep our bowels regular, they help to control blood sugar, and they help keep us full longer. That said, some whole grains are a little higher in potassium, but we would start with those fruits and vegetables and the other things on the list that I went through to help bring down your potassium before we would ever suggest restricting whole grains. And that really has been a change in practice that I've seen over the last couple of years. And it was always something that was a little bit confusing for people who are following a diabetic diet and then were introduced to the kidney diet. And hopefully now that we include whole grains again, it'll be a little less confusing and easier to switch to a renal diet. The next slide is about protein. And when I think of a kidney diet, I always think about protein. It's important for us to get enough protein every day. We don't store protein. We need to supply it every day to keep our muscles healthy, to repair tissues, to fight off infections and heal wounds. But with kidney disease, we want to avoid eating excess protein. If you have reduced kidney function, we know that if you eat too much protein, you can lose that kidney function more quickly. There's also some good evidence that replacing some of the animal protein, some meat, with plant-based protein can be beneficial to your kidneys. This has been linked to lower blood pressure, lower heart disease, and less protein lost in your urine when you eat plant-based protein versus animal-based protein. Legumes also have a low glycemic index, so they break down into sugar more slowly and they can help to regulate blood sugar. When we're talking about protein, we suggest moderate portions for kidney disease, and that means about palm-sized or about the size of a deck of cards for a piece of meat or chicken or fish. Replacing some of your meat-based meals with vegetarian options can be beneficial to your kidneys, as well as avoiding processed meats. Meats that have a lot of salt or other additives in them are best to avoid when you have diabetes and chronic kidney disease. And the reason for that is the extra salt in the processed meats might increase your blood pressure. And just like high blood sugar can damage your kidneys, high blood pressure can also damage your kidneys. So a low salt diet is recommended for almost everyone with chronic kidney disease. To limit sodium, it's important to buy fresh foods more often and to try to cook from scratch more often rather than restaurant or processed foods. And the Kidney Foundation has a wonderful website, the Kidney Community Kitchen, that has lots of low sodium recipes to get you started. Instead of using salt to flavor food, trying lemon juice or garlic, spices, or herbs to add flavor. And I get many questions about, is sea salt better than salt? And really, salt is salt. So whether it's Himalayan pink salt or sea salt or garlic salt, none of them are good for your blood pressure. It's better to avoid all of those salts and the extra sodium. If you're buying canned foods, you can look, there's many options now where there's no salt added, canned vegetables or canned fish, or you can rinse those foods with water to remove some of the extra salt. It's also important to read the food labels and compare the sodium content between similar foods. So every food has a label, and unfortunately here my circles are a little bit off on this slide, so I'm going to use this pointer And it's really important to look at the portion on the food label, and then we're talking about sodium right now. So unfortunately my circles just got a little askew here. So in this example, 3/4 of a cup of this food, and often food packages aren't talking about the whole package, just a certain portion of that package, and it tells you that in that 3/4 of a cup there's 75 milligrams of sodium. For a low sodium diet, we're aiming for less than 2,000 milligrams in a day. So out of 2,000, 75 milligrams is not very much. So the lower that number of milligrams, the better. The other thing you can look at is this percent daily value. So they'll compare this 75 milligrams to how much you should have in a whole day. And they're using either 23 or 2400 milligrams to make this calculation. So out of that, this one serving of food only provides you with 3% of your salt for the day. And as you can see by this guideline here, if it's close to 5% for the daily value of sodium, that's very little. If it starts going over 15% for the percentage, that's getting to be too much salt. The general rule of thumb is try to choose foods that don't give you more than 10% for the daily value of sodium, and that will help to control your blood pressure and keep your salt levels down. It can also help control swelling. Another good reason to avoid processed foods is that many processed foods have added phosphate. So this is an ingredient that's used to change the flavor of food or the texture of food or to keep it on the shelf longer. And we know that having foods with a lot of phosphate additives can do some damage to your kidneys, because it's up to your kidneys to keep calcium and phosphorus in balance in your blood, and they have to clean out all the extra phosphorus that your body doesn't need. These phosphate additives are very well absorbed, so we absorb almost 100% of them when they're an ingredient in our food. And then your kidneys are left with trying to get rid of that extra, and it can do some damage to your kidneys and your bones and your heart to have those in your food. So when we're looking at phosphate additives, you want to look at the ingredient list and try to avoid foods with the letters PHOS or PHOS. So this is an example, sodium phosphate, of one of those ingredients you might see in food. This slide shows some common foods that would have phosphate additives. There's some colas, some processed cheese, a mac and cheese dinner in a box. Sometimes frozen foods as well can have phosphate added. There's some deli meats or hot dogs, wieners, ham can often have phosphate added. And this mac and cheese example shows you that for phosphorus, we're not looking in the nutrition facts like we did for sodium. You want to look in the small print in the ingredients and try to avoid foods that have any of these PHOS words. And in this example, there's 3 different ones in this mac and cheese meal. One other source of phosphate additives is seasoned meat. And my next slide shows that. So this is some raw chicken at a grocery store. And I blew up the label here, and you can see the word seasoned. But if you looked at the chicken in the package, you don't see any seasoning. And that's because it's not really a seasoning, it's a preservative that's been injected into the chicken. And you can look at the ingredients here, and sodium phosphate is one of those ingredients that they're putting into the chicken. That helps it to stay on the shelf a little bit longer, and the salt that they add helps to hold on to this water that they're adding, so the chicken is not as dry. This is a practice that's commonly done with pork and chicken in the grocery store. So when you're looking at buying fresh meats or frozen meats, you want to take a closer look, and you want to try to avoid foods that have the word seasoned on the package or that have an ingredients list. You want to just buy chicken or pork. You don't need any extra ingredients. And in this example, there's a nutrition facts table. That's somewhat unusual on a fresh meat, so you want to question that and look closer to see if they're adding anything. On the right-hand side, you can see on this package of meat or chicken, there is no ingredients list. It doesn't have the word seasoned. There is no nutrition facts, and there are no additives in this one. So this would be the better choice when you have chronic kidney disease, to avoid that excess salt that's added and also the phosphate. Going back to some of the important points for following a diabetes and kidney diet, again, eating regularly. So those 3 meals a day, and trying not to go more than 6 hours in between eating. If you're going to have a delay between meals, more than 6 hours, then you might need a snack. And that's especially important if you're on medication that lowers your blood sugar, like insulin or some of the other diabetes medication. And you might need an evening snack as well. And it's important to prevent low blood sugars by eating regularly. It also helps to control your hunger if you eat at regular times during the day. If you don't eat enough early in the day, you tend to be hungrier later and snack more at night or eat bigger portions at night. And that can be hard to control your blood sugar and also for controlling your weight. As Lydia mentioned, when you have chronic kidney disease, as your kidney function declines, you're at a higher risk of having low blood sugar. And that's partly because your kidneys clear out insulin and some of the medications you might take for diabetes. And if your kidneys aren't working as well and you inject insulin, the insulin might stay around longer than it used to, and it might act a little bit different. Also, as your kidney function declines, sometimes appetite is involved, and you might not eat as much as you used to. So you might be at a higher risk of a low blood sugar. And as she mentioned, it's important if you're having low blood sugars more often to talk to your doctor and see if you need a decrease in your medication to prevent those low blood sugars. When you're treating low blood sugars and you have chronic kidney disease, it might be better to use something like Rockets or Lifesavers or the Dex-4 tablets that you can pick up at the pharmacy. These can help to treat a low blood sugar without giving you extra potassium. If you're used to using fruit juice, that can end up giving you too much potassium. Unless you're treating a low blood sugar, and then you really want to try to avoid high sugar items. We get enough carbohydrates from all the food that we eat, from the fruits and the starchy vegetables and dairy and all the grains, that it's really hard to control blood sugar if you include things like regular pop and juice and syrup and jam, honey, cakes, candies, and chocolate. It is okay to use sugar substitutes if you need that sweet taste, and that's probably safer for you when you have diabetes rather than adding extra sugar. Just a word about alcohol. Having too much alcohol can make it hard to control your blood sugars, and it can make it hard to control blood pressure as well. So what's recommended is, if you're a woman, to have 1 or less drink a day, and for a man, up to 2 drinks a day. A drink would be defined as 5 ounces of wine, 1.5 ounces of liquor, or 12 ounces of beer. We were talking about phosphorus before, and beer is higher in phosphorus, and some wine can have phosphate additives in them as well. If you're using liquor as your drink, you want to be careful what your mix is. Club soda or water or Diet Pop, but not Diet Cola, because those have phosphoric acid, that phosphate additive that's not good for your kidneys. And if you're drinking alcohol, you're at an increased risk of a low blood sugar. So it's really important that you have a snack if you're having an alcoholic beverage. It's probably better to drink water rather than alcohol, and drinking plenty of water is very important for your kidneys. If you become dehydrated, that's really hard on your kidneys, so you don't want to cut back in the amount of water that you're having. The only time you would cut back in the amount of fluid is if you have heart failure or if you've progressed to the point of needing dialysis. At that time, sometimes you have to cut back in the fluid that you drink. But with chronic kidney disease, you want to make sure you're drinking plenty of water. So in summary, for the diabetes and kidney diet, you want to eat 3 balanced meals a day. Eating regularly really helps to regulate your blood sugar. You want to try to avoid excess protein. So keeping your portions of meat and chicken and fish around the size of your palm. A bigger person needs a little bit more protein than a smaller person, so using your palm as a guideline is a good way to do it. So a bigger person would have a little bit bigger palm of your hand than a smaller person would. Think about replacing some of the animal protein in your diet for plant protein, like from beans and legumes, lentils, and tofu, and that can be beneficial for your kidneys. Really try to limit processed foods because they have extra salt and the phosphate additives and sometimes potassium additives as well. It's important to eat less sugar and drink lots of water. And if I had another thing to add on there, Lydia alluded to, it would be exercise. Be active. Try to get 20 to 30 minutes in a day, and walking is a great form of exercise. It can help with your blood pressure, your blood sugar, your heart health, and then try adding in some resistance exercises about 3 times a week, like weights or stretching, and that can make your blood sugars improve because your muscles become more sensitive to the insulin that you have. And thank you very much for your attention, and I'll turn it over to Rosemary.
I'm going to start by telling you a story. There once was a woman who woke up one morning, looked in the mirror, and noticed she had only 3 hairs on her head. Well, she said, I think I'll braid my hair today. So she did, and she had a wonderful day. The next day she woke up, looked in the mirror, and saw that she had only 2 hairs on her head. She said, I think I'll part my hair down the middle today. So she did, and she had a grand day. The next day she woke up, looked in the mirror, and noticed she had only 1 hair on her head. She said, well, today I think I'll part my hair in the middle. So she did, and she had a grand day. The next day when she woke up, she looked in the mirror and noticed she had only 1 hair on her head. Well, she said, today I'm going to wear my hair in a ponytail. So she did, and she had a fun day. Well, the next day she woke up, she looked in the mirror and noticed there wasn't 1 hair on her head. Yay, she exclaimed. I don't have to fix my hair today. What motivated that woman? What made her choose every day to have a positive attitude, or even to get out of bed? Life is about choices. Common sense tells me I would always, without fail, make choices that would impact my life positively. But experience tells me that's not so. I'm an example of someone who, when diagnosed with diabetes, had every reason to choose a positive management style. You see, I was a registered nurse. I had lots of head knowledge about the disease, and I saw lots of negative outcomes of diabetics who had poor management styles. Despite this knowledge, for many years, I chose management skills that were detrimental to my long-term health, eventually leading to the diagnosis of chronic kidney disease. It was that diagnosis that was my wake-up call, that motivated me to change my attitude and start using positive management skills. I was told I was the captain of my ship, and my ship had not been going very well. Anyways, after using positive management skills, I have reaped benefits ever since. So today I want to explore reasons for choosing positive skills or even not. My goal today is that my story might motivate you to choose wisely how you manage your diabetes, that you be excited about the power that you have and what you do and don't do. It's not as hard as you imagine. Don't give up. It's never too late to manage positively. I'm going to start off with motivation, although as I read this over, I felt that motivation really covered everything. But nonetheless, I've done it, motivation and other points as well. And these are under the heading of key elements. Motivation is influenced both by internal and external factors and is as different as we are all different. Sometimes what we tell ourselves can motivate or not motivate us. Things that I told myself was, it can't be. No one in my family has this. Maybe it will go away. I never admitted that to anyone because I knew they'd think I was crazy, and I was a nurse. I should have known better. Anyway, I was told that I was a type 2 diabetic and had to lose 25 pounds. So I did. I was highly motivated then because I thought I could get it to go away. So I kept on the 1,000-calorie diabetic diet. I walked, I biked all over the place, and in 3 months, I reached my goal. Diabetes did not go away. A year later, I was put on insulin. I blame myself for not sticking perfectly to my diet. I know now I was a type 1 diabetic, and it was not my fault. As the years went by, I felt good, even though I kept my hemoglobin A1Cs high. Like 15 or 16, I'm embarrassed to tell you. I told myself it worked for me, as I never got sick, and I seemed quite healthy. Actually, the joke at work was that I ran on higher octane than anyone else, because I had more energy than they did. Sometimes we believe lies. Some of these lies are like, it's too hard to limit certain foods or not have others. I have better taste buds than other people. That's why it's harder for me. I can't do this. I know no one was forcing me to eat. I was actually making the choice to eat inappropriately, although I would have said that I couldn't help it. I was not routinely checking my blood sugars. I wasn't writing them down. I wasn't making wise diet choices. Another lie that I told myself is, I can tell what my blood sugar is by how I feel. I truly believe this. In reality, I was sometimes right and sometimes not. This especially applied to low blood sugars. And once I learned to check, I was surprised when a felt low was actually a high. What we think we need. Sometimes we think we need things that we actually don't. Sometimes we think we need a new doctor, a happier doctor, or a more sympathetic doctor, a new job, less stress, a different family, the kids to grow up, then I'll be better, different circumstances. To avoid low blood sugars at all costs. I absolutely hated the feeling of low blood sugars and would do anything not to have them. So I found if I kept them high, it wouldn't interfere with my job or activities with my children or anything else I wanted to do. That was a very bad thing to have done. It contributed to diabetic eye changes and kidney changes. What we do need, though, we need knowledge and understanding of how we can affect the progression of our disease, both good and bad. We need an understanding and belief that we can make a difference. We need to realize that we do have the ability to choose to or not to be involved in our care. We need to realize that our healthcare team is not our enemy. They are there to support us. They want us to be successful in understanding and participating. What motivated me to change was the sentence, "You have chronic kidney disease, and in 10 years, you'll need a kidney transplant." Well, that was my wake-up call, or my light bulb moment. Then I needed to work on achievable goals. I always had a goal when I left my doctor's office that in the next 3 months I would stick to what I was told to stick to and do what I was told to do. But I never did it. That goal was too much of a long-term goal. So I had to make achievable goals, which meant to me short-term goals, very short-term. I had to start just doing one day at a time. I decided that for one day I would check my blood sugar 4 times a day without fail and write down the answer even if I didn't like the number because it was high. And that I would check my blood pressure and I would record those things. And when I was successful in one day, I thought, maybe I'll try another day. And gradually I thought, well, maybe I can do a week. These were small goals, but they turned into longer-term goals. After doing a week, I looked at it and I thought, well, maybe I could do a month. You see, when you achieve a short-term goal, it is actually motivating to work at longer-term goals. When you see success, it's very motivating. And as the goals got to be longer, and I noticed that writing blood sugars down that were high also motivated me to stick closer to the diet that was wise for me to eat. We need to help these short-term goals produce long-term change. Again, it's the forever part that becomes difficult, but don't give up, recognizing that this may be a time, may be a battle that we need to win. I found the longer I kept records, it became a habit for me. I made different habits of being able to eat. An example would be, I decided not to, when I ate out, which I like to do, I decided not to order dessert. And that gradually became a habit. If I would eat a meal out, I wouldn't order dessert, I'd order a cup of coffee instead. I was able to go to the coffee shop and not order a donut, not even think about it. It just became a habit. And actually, keeping records also gave my doctor something to work with. And she was able to put me on a sliding scale of insulin doses. My doctor's goal was to have my blood sugar never to be over 8. After record keeping and making good dietary changes, a more realistic goal was never higher than 10. This was achievable and kept my hemoglobin A1C less than 8. We also realized that I was a brittle diabetic, meaning hard to control. My relationship with my doctor greatly improved, and I no longer dreaded to go. Eventually, after 7 years, I had to go on dialysis. I chose a home dialysis called peritoneal dialysis. And that's what I continued with till I was transplanted. Balance. We need to balance between what we hope for and what is reality. So we need to know, what does hope look like? Certainly not what I had thought it was, that the diabetes will go away. Will I feel better physically or emotionally? Will it be worth it for me to manage well? It certainly was psychologically worth it. To know you are doing your best and that you are a vital part of your healthcare team is well worth it. When I tell you it's never too late to start, it's true. I went into kidney failure because I wasn't doing my part. But later, after 15 years of taking charge of my so-called ship and managing my diabetes positively, I got a call for a kidney transplant. It was actually on Mother's Day. When the transplant doctor examined me, he looked up and he said to me, "You must have taken care of yourself. You're very healthy." I had not heard that word before. I made sure there was no one else in the room he could have been talking to, but it was me. And then he said, "You're going to do well with your transplant." I never saw him until I was discharged after transplant from the hospital, and he said to me, "See, I told you you'd do well." And that was 10 years ago. A support group can also be an encouragement by seeing others in similar situations. You can see different attitudes that people have and strategies they use. You can hear stories of successes of others, which can ignite the hidden hero that's within us. We can see what others have been able to do. New research can be encouraging and give us hope. Just be careful where you get your information and what you believe. The Kidney Foundation has a monthly e-news, as well as their twice-yearly Kidney Living magazine. Reality says, "I won't get better, but changes I make will make a difference." Reality says, "You will have to work at it. Do not expect it to be easy." Sometimes it may be frustrating. I did find the longer I worked at it, it became less difficult. Understand what you can control and what you can't. Combining a diabetic diet and a renal diet was a bit of a crisis for me. I was just getting used to the diabetic diet and appreciating how healthy it was when I had my first visit to the renal clinic. I then realized how very different a renal diet was, and unless you have kidney disease, it's not a healthy diet. Now I was told I had to combine a diabetic diet and a renal diet. And all I heard was all the stuff that I couldn't have, and it overwhelmed me. I felt like I could eat nothing. That, of course, wasn't true. And I learned to focus on what I could have rather than what I couldn't have. And sometimes I had little times when I got frustrated, and I'd give Melissa a call, and we'd talk, and she'd look up some recipes that might be helpful. And after that, I felt good. The renal team and your health team is always there to help. Don't let yourself become your disease. We need to see this disease, diabetes, fitting into our normal life. You should be able to continue doing whatever you like to do, although it may mean some modifications. I liked hiking and had to learn to do this and control my sugar levels. Keeping blood sugars high, it was not the best method. So I learned better ways of doing it, actually. We need to identify what's important to us, what gives us joy and happiness. My children have only known me as having diabetes. I never knew if they would develop it or something else. I wanted them to learn that no matter what happened to them in life, that it never needed to overwhelm them. So I knew that I had to model that in my life. They had to see me not as a diabetic, but as a person with other likes and enjoyment. When I was diagnosed with chronic kidney disease, I actually ended up on the top of the kidney pancreas list because I was going to get them both at once. Then I developed cancer. Then I had to wait longer. Anyway, we dealt with that. And actually, the same year I developed cancer, both my children got married. Anyways, I managed to go to both their weddings and all the showers I needed to go to. And 2 weeks after it was breast cancer, my daughter had a shower, and they asked me if I'd speak. But they said I didn't have to if I didn't want to, but I did. As a matter of fact, breast cancer doesn't give you that much pain, to tell you the truth. Anyway, yes, I had diabetes and had chronic kidney disease. But I was and am more than that, and you are too. I did other things and had other interests. Our family, although affected by diabetes, was not ruled by diabetes or chronic kidney disease. When our first grandchild arrived, I was on dialysis. I dragged all that stuff down there, and I was able to stay down there and help my daughter for a few days, and it was well worth it, and it was a great joy. Change. You need to know that change is within you. I always had the ability to change. The only reason I couldn't change was because I didn't think I could. I had to decide to do it and do it. I was so pleasantly surprised with the results. I wished I had done it earlier. You are the only one stopping you. We have no one else to blame but ourselves for not being motivated to be actively involved in managing our disease. I know that was true for me, and I do regret that I didn't sooner. Although I regret it, I can't wallow in regret. I live in the now. Yes, I reap the results of no compliance with getting renal failure. Although I don't wish dialysis on anyone, it is life-saving and not to be dreaded or feared as you might think. I did it for 7.5 years. We control our own habits. Make yours good ones. Active and empowered. You are vital in your health care. Be active in it, and you will reap the benefits. As your attitude becomes one of willingness, you will begin to feel a partner with your healthcare team, a team member. Partners have input into their care. It is empowering to realize you are needed and vital. You are the one keeping records that no one else in your healthcare team can do. Once I saw a nephrologist. I was on dialysis then, and I had kept good health records. Anyways, it was the first time I saw him, and I gave him all my records, and he looked at me and he said, "There are doctors who would pay for patients like this." Now, I never got paid, I'm sorry to say, and I never went out looking for someone who would pay me. But anyhow, it still made me feel good. And it's nice to know that your doctor likes you. Keep gaining knowledge of your disease, as it will help you to understand the relevance of record keeping. Honesty. Sometimes it's hard to be honest for fear of reprimand. No one likes to be reprimanded. It was hard to be honest when I was managing poorly. I already knew I was not doing well and hated hearing what I already knew. I suppose it was thought that the harsher the reprimand, the more motivating it will be. It may work for some. It could go the other way. My friend got fired from her doctor and told to come back when she's ready to work at it again. Only through honesty will you get wise treatment. And only when the healthcare team are honest with us about what could happen to us do we have all the facts. Truth can be motivating. Let your healthcare team know how you feel. You may be surprised that they can help. They may have strategies you never thought of. Handling depression and staying positive. Depression is normal in any chronic disease. You have it forever. That's a long time. We get tired of it. Just don't get stuck in depression. Exercise. Keep moving. Even if you're in a wheelchair, you can keep moving. Volunteer. Get out every day. Be in contact with people. Work part-time or full-time. Join a club. Get a hobby. Get your mind off yourself. And don't forget to reach out to others. If all you do is think of yourself, you will be overwhelmed and get depressed. Focus on the positive, what you can do, your strengths. Choose to have a positive, upbeat friends. Be positive yourself. People like being around positive people. Identify for yourself strategies that will prevent depression. For me, I have decided that life is too short to waste time being depressed, as it accomplishes nothing good. If you can do something about depression, do it, because it's a waste of time. For me, success with diabetes and chronic kidney disease is experiencing the joy of living despite the situation. Yes, we choose much. It's all about choices. And in summary, when I managed poorly, I felt frustrated, embarrassed, guilty, always wishing I would do better and feeling like I couldn't do it. I felt anger with myself and some depression. Since choosing to be an active member in my care, I have felt both physically and emotionally better. I go to my medical appointments with confidence, and I'm a significant member of my healthcare team. I have input that is crucial to my care. I feel empowered. Finally, you are the captain of your ship. And I'll leave you with this one thought. Think about this. If you say you can, or if you say you can't, you're right.
I think this is where I'll jump in, and it's hard to come in after that wonderful sentiment, Rosemary. So thank you. Thank you all the presenters, for their insight and their input and sharing their knowledge with us today. This is the time where we invite all of you to ask some questions to our presenters, and so I certainly want to open that forum up to all of you. There are a couple of ways in which to ask a question. The first one being that you can type your question in the chat pod, and I just want to remind people that only the presenters and I can see the question you've posted, not your fellow participants. Or alternatively, if you would like to ask a question over the phone, you can do so by pressing *7, and that will unmute your line, and then you can ask over the phone just like we're talking right now, or I'm talking right now. I do ask that only those who are interested in asking over the phone unmute their lines. So we have 3 presenters today, so as you've heard, and we ask, if possible, if you want to preface if your questions to a particular person, if you can sort of start that, if you're writing it in the chat pod, by saying this question is for Lydia or what have you. If you can't remember the name, that's okay. I'll work on figuring that out. But I just ask, if you can remember, please do so. And I also want to note before we begin that we're going to post a few poll questions, and I'll post this one right now. And I invite you to answer all of these before you leave the session. I believe there's about 4 of them. Your answers are anonymous, but they help us tailor any future webinars to meet your needs. So I do encourage you all to take part in that. You can just choose your answer by clicking on the one that suits you best, and off you go. And as I said, there's about 4 of them. Okay, so I'll invite all of you, if you wish to type in a question or ask over the phone to any one of our presenters, and that also could be about the Kidney Foundation's services and resources that they have available to people that have been diagnosed and their care partners. Oh, someone moved that on me. If we can just leave the slides alone for now, thanks, because I can't go back once they're moved. So we'll just move to the next slide. So the first question here, perhaps the best person to answer this will be Melissa. What do you think of the keto diet? Oh, Melissa, you might have to unmute your line again by pressing *7.
Sorry, thanks for that reminder. I don't have a lot of knowledge about the keto diet. From what I do know about it, I don't think it goes well along with chronic kidney disease. With chronic kidney disease and diabetes, you have a higher risk of heart disease, and the keto diet is mainly fat, and that has been shown that it might increase cholesterol levels, which wouldn't be good. And if you're on certain medications to control diabetes, the keto diet is very low in carbohydrates. So it may increase your risk of low blood sugar if you're still taking your diabetes medication. So I'm not a proponent for a keto diet with chronic kidney disease and diabetes.
Okay, thank you. And so we have another question here, and Melissa, I'm going to call on you again. Just to reiterate, dialysis clients can now eat whole grains as opposed to just white bread?
For the most part, yes. So we've changed at the clinic I work at. We've changed our handouts to include whole grain bread and brown rice, whole wheat pasta. There are some whole grains that maybe are too high in potassium to try to include, like quinoa is quite high, but it has to be individualized. If a person, on dialysis can't control potassium, we might have to restrict whole grains, but that would be one of the last things we would maybe suggest changing. We would look at those other higher potassium foods first and change those before we would get to whole grains.
Okay, thank you. And Rosemary, this question is directed towards you. I was curious at the timeline, what the timeline was for when you were diagnosed with type 1. How long had your sugar run around 15 or 16 until you started to have a decreased kidney function? She says that she has a family member with type 1 who ran high like that, who is considered to be a brittle diabetic for some time until they got an insulin pump and CGM. So that's why she's trying to...
Oh, yes, the insulin pump helped me, yes. It was 18 years I showed signs of chronic kidney disease. But tell you the truth, I was showing protein in my urine years before that. But my family doctor just said, oh, there's protein in your urine, and didn't say anything. And I didn't recognize that that was a sign of early kidney disease. So it was really 18 years that I was after I ran high, A1Cs for probably 14, 15 of those years. The problem was I felt good. But anyways, when I went on an insulin pump and when I went on dialysis, it was like being on an insulin pump because I took short-acting insulin, and my A1Cs were wonderful.
Okay, thank you for that. Okay, Melissa, I'm turning back to you. What are your thoughts on a plant-based diet?
I think a plant-based diet is excellent. There's lots of research that can help improve blood sugar levels, blood pressure levels. It's good for the kidneys, can help, as I mentioned before, it can help slow down the rate of protein lost in the urine. There's also some evidence that it might help slow cyst growth for people with polycystic kidney disease. So I think there's lots of benefits of a plant-based diet and becoming either semi-vegetarian or vegetarian, replacing some of the meat-based meals with plant-based meals can be very beneficial for controlling blood sugar and slowing down the progression of chronic kidney disease. Excellent.
Thank you for that. So we have a few more minutes, and the questions seem to have sort of quieted down for now. While we're just seeing if anyone else has any questions, Lydia, I'm just wondering, not to put you on the spot, but I will, just if you can maybe take this opportunity just to speak to a little bit about some of the services that the Kidney Foundation of Canada is able to offer.
Absolutely, Gillian. Thank you for putting me on the spot, but I'm more than pleased to talk about that while we're waiting for a few more questions, if there are any out there. So I just wanted to let people know, if you're not aware, that we have an information referral service available to people with chronic kidney disease, their caregivers and healthcare professionals. So we are able to assist with individualized questions. However, we can't provide medical advice on those. We have a website and lots of education and information resources available. As Melissa spoke to earlier, we also have the Kidney Community Kitchen. So for people who have chronic kidney disease or diabetes, there's a great opportunity there for people to go on there and look at recipes, meal planners, and get some hints and ideas about changing up their renal diet. We also run a peer support service, and that's available one-on-one support groups and online. And if you are interested in that, please visit that at kidneyconnect.ca. And that's just a few of our services that we provide, and I welcome you to contact us directly if you have any more questions or are interested in hearing more.
Thank you very much. Okay, Melissa, you're on the hot seat again. What are your thoughts on a product like Cobb's Bread High Fiber White Bread? Are you familiar with that product at all?
I'm not familiar with it. I just did a quick Google search, and I'm just looking at it. So one thing with some some of the healthy white bread, sometimes I wonder about what additives they're putting in, and I'm always looking to make sure that they don't add a phosphate additive. When I look this product up online, I don't see any phosphate added. It doesn't have any ingredients that I would be worried about, I don't think. I'm not sure how it would differ in terms of a simple whole grain bread. So I don't know a lot about that product, I'm sorry.
That's okay. Any other questions before we close for today? Speak now, forever hold your peace. Okay, well, we'll leave it at that then. I do want to thank everyone for their participation this afternoon. It always makes for a great event when you have some questions and some discussion following a webinar of this kind, so thank you so much. And of course, a big thank you to our presenters, Lydia Lauder, Melissa Atcheson, and Rosemary Lejeune. There's a lot of work that goes in behind the scenes into making a successful webinar event, so that it goes above and beyond just for today. So thank you for all of your time and attention in making this a successful afternoon. Lydia, I think I'll turn to you. Lydia, again, as a reminder, is from the Kidney Foundation of Canada, and I'll ask you to say the final words before we close for today.
Thank you very much, Gillian. And on behalf of the Kidney Foundation of Canada, I just wanted to thank you for your participation, and particularly to our presenters. Melissa, a really well thought out and very informative presentation, and I even learned quite a lot from that. And Rosemary, just your motivation and your positivity, it was contagious. I'm sitting here in a room with a number of other staff members, and it was just infectious, just how wonderfully positive you were, and thank you so much for sharing it. And to Gillian, thank you for all your hard work and preparation. It's been such an easy way to run the webinar, so thank you. And a special word of thanks to Sarah Cruikshank from the Foundation, who did an amazing job with doing a lot of background work and preparing the presentations and the presenters and working very closely with Brain Exchange to make this happen today. Thank you very much, and I wish you all a really great afternoon.
Wonderful. Thanks, everyone. Have a great remainder of your day. Bye-bye.
Bye-bye.